Hi, I'm John Zidane, and today we have a special guest. Our special guest is Dave Tabaka, and today our title is going to be the Ohio Healthcare Reform Bill, okay, and the effect that it has on its seniors. I think my first question I want to ask you, Dave, you think I should probably pick out the funeral arrangements for my mother if she happens to have a pacemaker, or what should we do about this?
Well, John, I wouldn't go that far just yet, but we do have some deep concerns here about how this health care bill could affect our seniors, and that's what I'd like to talk to you about today.
Okay, go right ahead.
All right. Well, I'd like to just start out by saying that, I think our seniors are the heart and soul and intellectual core of this country. Each of our seniors represents a lifetime of experiences and achievements, and I would like to say to all the young folks out there, that enjoy their computers and their iPods and their cell phones and DVDs, keep in mind that it was, the people that came before them that laid down the technical framework that made all these achievements possible. I think that's important for people to remember.
Fought for our rights. I mean,
they sure did. They're the reason we're here and have everything we have. So we owe a lot to them.
Constitution's not being hurt by any effect, is it? I mean, we're good to go, right?
The Constitution, I think it's been a little pushed off to the side, and I think that we need to start getting that back on track again. That's what our country was based on, and its survival depends on, I believe. So, first of all, I want to just talk to you for a minute about a petition drive we're doing, if I could.
Absolutely.
I'm working with an organization called the Ohio Project. This is a ballot initiative that we're pushing. It's statewide, and it involves the health care bill passed in Washington. And what we're trying to do is get a constitutional amendment added to our state's constitution. You heard about the individual mandates in the bill, ordering folks to buy insurance. If they don't, they could be fined. The bill even calls for possible jail if you don't have an insurance policy that the government approves of.
Well, my understanding, that's a good thing because we've created all these jobs, haven't we? I mean, look what we've done for all these IRS agents. Come on.
Yeah, we created a lot of government jobs through this bill, which, as you know, don't create any wealth in our country or create any product that, will increase our GDP.
Right.
And add to that the fact that these jobs also, where do those people's pay come from?
Absolutely.
Taxes. So they're more a burden on our society than anything. But we are pushing this initiative through the state right now, and when we get the signatures we need, this would put a issue on this November's ballot that would allow the Ohio voters to decide if we're going to have these individual mandates in our state or not.
Okay.
So this would be it's a real short constitutional amendment. Anybody that would like to find out more about this, there's a website they could go to.
Okay.
It's real easy to remember the name. It's www.theohioproject.com. You can get all the information you want about it up there. There's a copy of the amendment, the exact text. People can read it. It's like a half a page.
Okay.
Unlike the health care bill, which is some 2,700 pages long.
So basically, if they go to that website, they can pretty much get all the information they want.
They could get all the information, and if they want to know where to go sign a petition, there's locations there. It gives you a whole picture of the state, and they can click on their county or any county they want to go to and find a signing location.
Is there a phone number there, Dave?
There is, but I don't have it handy right now.
Okay.
But if the folks would go to the website, I know some folks, not everyone has computers.
Let's do it this way. Until we get a phone number, if you'd like, you can also call 1-800-82-FIRST. Okay, that's 1-800-82-FIRST. That's me, and I will make sure that your call goes right to Dave, and we'll get this thing stopped.
Perfect. Perfect. And if I could mention one signing location in particular that we have coming up here on the weekend of, it's a Friday and Saturday of June 18th and 19th. We'll be out in Seville, Ohio.
Okay.
The annual citywide yard sales they have there.
Okay.
We'll be all over the event. We'll have circulators walking around, but we'll be set up in particular at the Seville Auto and Tire Service.
Okay.
Right there on Route 3, used to be the old marathon station there.
I got it.
So anyone that would like to sign, we encourage them to get out there and sign that petition, speak their voice.
Okay.
But one thing I wanted to get started talking to you about here is, of course, how this health care bill could affect our Medicare and our seniors.
Okay.
Okay. I've got some figures here that I want to talk to you about, and these come directly from CMS. And for any folks that don't know what that is, that's the Centers for Medicare and Medicaid Services. They're the federal agency that oversees Medicare, Medicaid, and more recently the CHIP program, the Children's Health Insurance.
Okay.
This bill, as some folks may have been hearing, actually cuts $500 billion from Medicare.
Holy mackerel.
That's billion, 500, over the next 10 years. Now, as this debate was brewing over these cuts, the folks in Washington who were opponents of this bill were talking about these being waste and fraud that they were going to cut out of the system. But you know, I have to ask, if that's the case, you know, why have they waited until now to cut all this waste and fraud?
Good point.
Doesn't make sense to me.
No, there's a lot more waste and fraud than we know about there that could be cut.
Yeah, and I'm going to talk to you a little bit about some of that. Another thing I'd like to point out about that claim, they've come out, the Democrats, particularly in Washington, and claimed that Medicare Advantage is not being cut by this bill. But then I got to ask you this, John, if that's true, why was it then that during the Senate Finance Committee negotiations on the bill was Florida Senator Bill Nelson, in order to secure his vote, given a special exemption for his state seniors from the Medicare Advantage cuts?
A special exemption?
Yes, sir.
What does that mean?
Well, it means to me that they are going to be doing Medicare Advantage cuts.
Okay.
That's what that tells me. I don't know. Seems pretty logical. And just to break that $500 billion down a little bit for you.
Sure.
And again, this is according to CMS. This is a federal agency. This isn't just people talking on the street. Cuts home health care by $39 billion. You know, these are people that need skilled nurses and whatnot to come to their home and help them maybe administer medications or treatments of various things.
Where's that money go?
Well, that's interesting. All of this, it's pretty safe to assume, is going to go towards the expansion of the healthcare system, making it accessible to more people. Basically, I don't know if you knew this, but out of 35 million people that the Democrats claim are going to be covered under insurance now through this new bill, 20 million are going to be covered simply by expanding the Medicaid system and putting them on Medicaid.
Wow.
So that's going to take a lot of money.
Now, the insurance companies don't get anything out of this, do they?
I believe they do. In fact, that brings up another point. You know, all through this healthcare debate, you heard the idea being pushed that this bill was going to make it so your insurance companies couldn't raise the rates on you, and you heard all that talk. You know, insurance companies keep raising rates and people can't afford the premiums. Well,
is that something like we're going to cut all the credit card interest rates so the people can't charge high credit interest rates anymore? So then the companies do a one-time increase of 26, 27%, and then they can never ever cut it again.
Probably, yeah, probably something of that nature.
Ah, that's a good thing.
Yeah.
Okay.
But you know, as folks are now turning past page one of this bill, so to speak, we're finding out that there's really nothing in this bill to limit insurance companies from what they can charge you in premiums.
Wow.
Yeah. So that's quite a deal for the insurance companies, isn't it?
Is there something in there about pre-existing conditions, Dave, that I heard about?
There supposedly is. We're still trying to find out if that's really going to be something that's going to be mandated to the insurance companies, that they can't deny a person for a pre-existing condition. But we'll have to, this is still yet to be seen if this is going to really come to fruition or not.
Okay.
I think that's a good policy. You know, folks should be able to get insurance, and, you know, the problem is they can call just about anything a pre-existing condition, you know.
Well, I read something about that, where they're not going to have that in effect till 2014.
Yeah, a lot of these provisions of this bill don't even take effect for a good while.
Why do you think that is?
I think that's for a couple of reasons. For one thing, when they were going to tell the folks what the bill was going to cost, I think what's going on here is a little financial accounting trickery. You know, if they can collect taxes and make cuts pertaining to this bill for 10 years, but only implement it for 6, that of course kind of shifts money over to the black column.
No, that wouldn't be happening now.
Well, I think that's what it's about, and there might also be an element there of political security.
Okay.
You know, folks, they might be worried folks are going to not like certain parts of this bill, and they would like to maybe see, you know, some of their parties reelected before things really start hitting. Could come into play there too.
Well, I heard under Medicare that skilled nursing is cut by $22 billion.
Yeah, I had something here. That's part of the $500 billion I was talking about.
Wow.
Yeah, $22 billion cuts funding to skilled nursing facilities.
Holy mackerel.
Which is, you just got to wonder where all those people are going to go now.
Where are they going to go?
I think what's going to happen here is we're going to find out that our nursing homes are probably going to be overcrowded and be full of people that should be in skilled nursing facilities, but are actually still in nursing homes.
That wouldn't raise rates now, would it, Dave?
John, everything I look at in this bill seems to me it's going to raise rates, contrary to the idea that this is going to cut health care costs in this country. And in fact, I don't know if you heard about this, but the CBO, you know, that's the Senate Budgetary Office, and they are the ones who all through that health care debate were coming up with what this bill is going to cost. Well, they just announced recently that on a closer look at the bill, it's actually going to cost more than they said.
Holy mackerel.
Yeah, and you know, they always talk about the healthcare cost curve, how it's been going up over the years. Well, they claim that this was going to bend the curve back down and start lowering costs.
Wow.
CBO now says that's not a fact. The curve is going to still continue upward.
Any effect on the taxpayers on this?
A ton of effect on the tax.
Am I going to be able to afford my health insurance, Dave?
That money's going to come from somewhere, and in fact, I could tell you about some taxes in particular that are going to emerge from this whole thing. Taxes on medical equipment. You know, this could be anything from pacemakers, artificial heart valves, to toothbrushes.
Wow.
Okay, there's approximately 80,000 medical devices in service in this country right now.
Holy
so that's a lot of devices. And what this bill does is it imposes a new 2.9% tax on all medical devices.
Wow.
So guess who's going to pay that?
Sounds like the patient.
Yeah, those typically, you know, when manufacturers are taxed for products they make, they're going to pass those taxes right along to you, the consumer.
How do they pay it if they cut our health insurance and cut all our benefits? Where are we supposed to come up with the money for that?
It's a good question.
Wow.
Good question.
Wow.
This is what's so concerning about all this, is that there's just too many unanswered questions.
I'm telling you.
Yep. And you know, also there's a new tax in this bill being imposed on insurance policies, or the healthcare insurance providers. And this thing is going to come out to be about $70 billion in taxes. This is what they're looking to take in from insurance companies. And again, guess who's going to pay those? You are in your premiums.
New taxes on top of the bailout tax money we just paid for?
Never ends, does it?
Holy mackerel. Wow.
Never ends.
Wow.
So anyway, I'm just really concerned about what's going to happen to our Medicare system. You know, things are hard enough for folks to afford right now. And I was just listening to the president talk the other day. He was having some town halls, speaking to some seniors about the Part D donut hole issue. I don't know how much you know about that donut hole. No. But this costs our seniors a lot of money. My understanding of it is that once a senior citizen pays their $310 deductible towards prescriptions, Medicare starts picking up 75% of their cost at that point. up to a number something like $2,830.
Okay.
Man, it's hard to believe seniors have to spend that much on their medications, isn't it?
That's ridiculous.
That is a lot of money. I don't even know how they do it. And then after that $2,830, folks have to pay 100% of their own drug costs up to $4,550. So this is what's known as the donut hole, this area.
Okay.
Now, the president's saying that this bill will gradually decrease that 100% they have to pay in the donut hole down to 25% by 2019. So they're doing it in gradual increments up through 2019. But again, when you look at this health care bill, I don't see much in it that's really reforming anything to save costs. So where is that money going to come from? That's a lot of money.
Yes, it is.
I mean, I would love to see our seniors get that, but I just want to know where it's going to come from. We got to be realistic about this. And you heard about the $250 checks that they're going to issue out to folks who are hitting the donut hole. Well, you know, I'm looking at these numbers, $2,830 to $4,550. I don't know what $2,250 is going to do for folks.
That's true.
That's just not much money right there. And again, where is that money coming from?
That's a lot.
Yep. Now, House Minority Leader John Boehner came out and commented on this, on these rebate checks. I don't know if you call them rebate checks. They're checks to help them cover their prescriptions. But again, I don't know how much they're going to be able to do with that. According to John Boehner, now I don't know how he comes up with this, but he said it, that more than 9 out of 10 recipients will never receive these checks. So, again, that was Minority Leader Boehner's comment. I'm going to be looking into that a little more to see what he bases that on, but he got my attention with that comment. So I do want to look into that a little bit more. You know, Medicaid is going to be under a big stress from this bill too. Like I told you a little bit ago, 20 million people estimated are going to be pushed onto Medicaid.
Medicaid virtually doesn't exist anymore with all the new spend down and Deficit Reduction Act. How could it be reduced anymore? It doesn't exist.
Well, and now we want to put effectively 20 million more people into the system.
Wow.
That's yeah, that's just incredible. And you're right, that system is already stressed. I don't know if you remember this, but back just before the president signed the health care bill, this would have been, probably in early March, Walgreens, believe it or not, they're the nation's largest
prescription
retail, pharmaceutical
It's good to see they're
chain.
Behind it. That's important, huh?
Well, you might want to wait a minute until I tell you what's going on
No,
here.
not Walgreens.
Yeah, they announced just days before the president signed the bill that in their Washington State stores over there, they're going to have to no longer accept Medicaid folks. And you want to take one guess why?
I can only imagine.
Because the government pays so little on those prescriptions that they're actually losing money at Walgreens.
So these are the people that are on Medicaid that have to have these prescriptions.
Right.
And they no longer can go to Walgreens.
They can no longer go to, in Washington State so far.
And isn't Walgreens, because they are the #1 prescription, my understanding Walgreens had pretty good prices for the seniors.
Oh, yeah.
Very reasonable.
Absolutely.
So
That's
then
one
having
of the
to
things that
leave
made them #1.
Walgreens, that's going to make that cost to them go
Sure.
up.
Absolutely, a good point.
Wow.
They're going to have to go somewhere else that is going to effectively charge them more.
Wow.
And and it cuts their accessibility down a lot. Because there's a lot of Walgreens locations just in that state, and I'm afraid that could spread to other states. And then you take what I just told you and think again about 20 million new people being put on Medicaid.
That's amazing.
You'd try to do the math on this, John, and it just doesn't come out. It just doesn't come out. In fact, I'll give you a number just in Ohio. Now, I'm going to tell you where I got this from, so I'm not just throwing numbers out at you.
Sure.
I recently read a really great book by Dick Morris and his wife, Eileen McGann. It's called 2010 Take Back America. And in their book, they do a calculation of what I'm about to tell you about based on data from Kaiser Permanente, okay, pretty well-known insurance firm. According to their calculations from that data, these Medicaid expansions are going to cost the state of Ohio alone $399 million additional dollars per year.
You're kidding.
No, I'm not kidding.
Where are we going to get the money?
Well, again,
from where? Do we
you
just?
know,
Oh, I know. We print it up. We print it
well,
up.
we can't print money. Only the Federal Reserve can print money. That's the problem. And
Okay.
even when they do it,
Okay.
it's not a good thing.
So we can't even print it up.
No. We're going to have to come up with that money somewhere. So we're either going to have to divert that from other things in our state's budget, which is already pressed to the wall. I was just talking to my representative, Ron Amstutz, the other day. He's the head Republican in the House in Ohio who works on the Ohio budget.
How's he feel about this?
He's beside himself. He was telling me, I don't know how we're going to cover all these programs, and the health care bill coming along is they just have no idea what they're going to do down there. I think I do. I think taxes are going to go up. I mean, it's the only, it's what always happens.
Well, you've also heard about the socialized medicine that they had in Canada.
Oh, I've heard a lot about it, yeah.
How would you compare that to what's about to befall us?
I would say we could probably take some lessons from them, and you know, they have situations up there where folks have to wait a long time for basic medical care. You know, like here, it's pretty nice right now. You go to your doctor. They might say, yeah, you call your doctor rather, and you know, I need to see the doctor, and they say, yeah, can you come in? Oh, I've had them tell me tomorrow. Do you have time tomorrow or the next day, or maybe 2 days, you know, 3 days later? There are folks for certain basic kinds of medical needs that wait up to 3 months.
Oh, come on.
No, I'm serious.
3 months?
3 months. And in fact,
your cold would be over after that. My goodness.
I could tell you a little something interesting about that right here in the United States. I'm sure everyone's familiar by now that the state of Massachusetts has a sort of universal health care program in their state.
Wow.
Okay, now just to kind of back up what I just said about Canada, we've got it going on here. Now this was a study done by Bloomberg News on the Massachusetts healthcare system.
Okay.
They found that the average wait in Massachusetts to see a doctor is 63 days.
Oh, come on.
No, 63 days. Bloomberg News. You can go look that up.
And what's that because of? Why did that happen?
This is mainly because of just all of the new people being put onto the system.
Wow.
And these doctors, it's just like anything else. When you've got people lining up, you get at the end of the line, and you're going to wait. And this 63 days, compare that to, say, Miami, where the average found by Bloomberg was 7 days.
Okay.
Quite a difference there.
Wow.
So there's obviously
I mean, if you need to see the doctor, something serious could happen to you, especially for these elderly seniors.
Yeah,
63
and,
days.
People need to get in to see the doctor, and this has always been one of the greatest things about our healthcare system, is that the availability of doctors, the expertise of doctors. You know, I have always thought we've had the best healthcare system in the world. You know, and you know, my parents, they use Medicare and Medicare Advantage, and they've always gotten top-notch service from their doctors. And I'm really just worried about what this bill is going to do to all that.
I'd be a little concerned myself.
You've got some people, you know, pretty important people here who've come out and talked about this, in particular about the Massachusetts healthcare system. This man here, Alan Gorel, he's the professor of medicine at Harvard Medical School. And he said this, you can't increase the number of insured unless you have a strong primary care base in place to receive them. Well, I don't even think it takes a Harvard professor to say that. I mean, that's pretty simple logic, isn't it? Another gentleman, Tom Daschle, he was former Senate Majority Leader, and if you remember, he was Obama's first choice for Secretary of Health and Human Services. He said a similar thing, if you expand coverage without expanding primary care, you will overwhelm emergency rooms that are already overcrowded. So this is another fear that this is going to push a lot of folks into emergency rooms.
Wow.
And they're just not equipped to handle those kinds of numbers of people.
Well, I read something about that now with this new health care bill, there's going to be a panel, and they're basically going to be judge and jury, and they can pretty much decide what particular things are going to be effective based on certain percentages. Say like a Plan A, you know, is 70% effective, where Plan B is 50% effective. And then if they decide that it's not effective enough, they could just eliminate that, and that really means that the people could end up with less health care. Okay, or if something they need, such as a pacemaker. And I started reading this, like, oh, come on, you're trying to tell me that they're going to deny retirement people this kind of coverage? That doesn't even make any sense to me. It sounds science fiction to me.
Well, it does, doesn't it?
Yes, it does.
But let me tell you a little bit about that. What you're talking about is comparative effectiveness research. And you might remember back during the health care debate, former Governor Sarah Palin talking about death panels. You've heard this term. Now,
yes, I
don't.
Hear
it's
that.
a scary term. It's not one that I know I would like to use. But
Dr. Kevorkian.
Exactly. Actually, a little different. Now it's the government.
Okay.
But let me tell you a little bit about what this is and why it is that folks who were proponents of the health care reform were claiming that this is not in the health care bill. It's because it's not. This was in the stimulus bill, John.
Oh, man.
You didn't even know that, did you?
No, I just knew it was pretty thick.
Well,
you know?
yeah, but this was slid into the stimulus bill. This is a new council that they created that falls under HHS, the Department of Health and Human Services, and it's called the Federal Coordinating Council for Comparative Effectiveness Research.
Holy mackerel.
That's a mouthful, isn't it?
You ain't kidding.
1.1 billion was allocated for this council.
Shit,
and guess how many people are on it?
How many?
15.
Hey, new jobs.
New jobs. We're creating jobs
New
again.
jobs for the death panel.
15 new people get to split up 1.1 billion. That's pretty good.
Wow.
But what these folks will be doing is they study the effectiveness of various drugs and treatments, and then they recommend clinical guidelines for payment, coverage, and treatment. So just let me give you a little example of what they might do and why it concerns me for people's health care. Say this research reveals that treatment A works 70% of the time and treatment B works 50% of the time. Well, it would be the job of this council to say, well, then treatment A is the better treatment, so we're going to pay for that through the government system. But what about the 30% of folks who didn't respond to treatment A and might respond to treatment B? Or even a smaller group that might respond to treatment X, Y, or Z?
Wow.
They're
you know what I'm seeing?
Not going to be able to get that treatment.
I'm seeing something here. This bill I heard was over 20,000 pages or something, and I can definitely see there's a lot more information we've got to cover here. Okay, so
Yeah,
I think what we're going to do is we're going to have a second program called the Healthcare Reform Bill Part 2, and I want you people out there to listen. I want to thank our guest Dave for coming, and we are going to bring back Dave because he has some interesting information for us. Okay. So the next time, thank you very much. I'm John Zidane, and this is my co-host Dave. We will be talking healthcare, the reform, the effect on seniors. Thank you, and have a pleasant day. Bye.